Hello. So yes, most of you know both me, Sandra, I'm based at the Holman Clinic, and Collette, who's McGrath, based over at the Cancer Council, and we work together for all of the breast cancer patients we have in the north of the state, northeast, and Jill is the new McGrath one from up the northwest. So if anybody's from the northwest, that's the new northwest girl. So we're here to talk about our local support that we have here in the north and a little bit in the northwest, and how we can support you, because that's our job. In the button you look. Oh, there you go. So, breast care nurse role. We're here to provide support and education from the time you get diagnosed with your breast cancer to not only you but also your family, friends. We're available to anybody. We don't care who rings us. We're happy to support anybody. We make sure that through your whole progress of your treatment that you're getting the highest possible care that you can get from both the medical team, the nursing team, and any other support people you come across in the field of your care. And we've usually got a fair bit of background of education and knowledge and skills from wherever we've worked. So whether it's been that we've worked for 20 years, like some of us, on a surgical ward where we've looked after all that surgical, or we've been down in the chemo unit and worked there for however long. We've got that experience and know what you could possibly go through, not from our personal experience because we've been there ourselves, but we've seen it with other women and men, and can see how we can support you. So one of the main things we always, from the very start of meeting people, direct people to, is to the BCNA and the My Journey and their symptom tracker. We find that is the best thing. We don't like Dr. Google. We tell everybody do not use it. And if you ring me up and say, "Oh, Sandra, I've been Googling," and I go, "You're naughty, I've told you," use BCNA. That is where we know the advice is, the research is, and to be honest, sometimes that's where I go to if I want to find out information that I'm just not sure of with some questions. So, yep, and I think you will all know, even now, how to access that on the online thing. So, yep, get out your phones. I even say to some of the old ladies, because not everybody's in their 50s or 60s and know how to use a phone. Some of those 80-year-olds, it's like, get your granddaughter to get your phone out and find out how to use this, because it's the middle of the night when you've got the questions, and I'm sorry, I don't work 24/7. So one of the other best things we use in Launceston is the Cancer Council, and we are so lucky in Launceston that it's right across the road, just through the park, that we can direct people to. They have a range of services that is there to support whether you've got breast cancer or any other sort of cancer for you or your family or your friends, whether it's just go to talk to somebody, sit quietly and have a cup of tea while somebody's having an appointment, or even using their car park. They have great things like support groups and massage and legal advice. They have a financial assistant program. They have the wig library, which I can tell you that's going to be very much updated in the next few months from a big thing we did on the weekend. They also even have scholarships that are available for some students, and I was lucky enough to have one of my patients, her daughter, got one of those scholarships earlier this year to help her with her further study. So very much, if you want, just walk in there. If you don't want to walk in there and you want one of them to ring you, ring me or Collette and we can put you in contact with them. The button doesn't work. So that was just my little idea that you could see that there is so many resources there available in our very beautiful and lovely place of the Cancer Council in Launceston. And now it's Colette's turn.
Right, hello everyone. So as Sandra mentioned, we are here ideally from the beginning of diagnosis all the way through, whether or not it's surgery first or neoadjuvant treatment, through radiation and onto hormone therapy and then into that survivorship phase. So we try our best to be available through all the phases, and highly recommend that. If you haven't heard from us, it doesn't mean that we've dropped your care. It just means that you are welcome to contact us at any point, whether or not it's a few weeks after diagnosis or a few years. We're always here. So other local support services, we highly recommend getting involved with a exercise physiologist or physiotherapy. So as part of our role, we make sure that all our patients have been referred to a physiotherapist after surgery. We are looking into some particular patients being referred preoperatively for certain criteria. So in the north, we have a very experienced lymphedema specialist, Tracy Walker. She works out of Imbalance Physio in Charles Street and does have a small private practice as well. We also have the lovely Orla, who will be coming later this afternoon to present, and she's based at the Launceston General. So we make sure your physio has seen yourself, the patient, on the ward, often the following day for a run through particular exercises, and then you automatically get referred to a community physiotherapist or lymphedema specialist to follow up on maintenance and monitoring of any lymphedema development, but also just your general physical function. Down the East Coast, we have a really lovely clinic, the St Mary's Lymphedema Clinic, so a great resource for the clients down the East Coast. And I have heard recently that a couple of our northern physiotherapists are heading down to St Mary's for a few days, so anyone that comes through Calvary St Vincent's, but also through the Launceston General, we can link you in with the East Coast support. So in the northwest, and Jill's a great go-to person to get in contact with this as well, but the same process. If your surgery happens up here in Launceston, you will still be referred to a northwest physiotherapist for that physical support as well. We highly recommend making sure that your mental and emotional support is covered as well, so whether or not that's through some local psychologists that we have here, through counsellors, social workers. We have community social work that's linked into the LGH and the THS, or coming into, like Sandra mentioned, the Cancer Council support service as well, which is a really beneficial place to come in. And then the lovely Katie Jane, who will be around later as well. She's our local exercise physiologist and is a very good go-to person in regards to getting that exercise, as we know that helps your overall recovery. Right, so Cancer Council, as we touched on before, definitely available through the northwest as well. They do have some face-to-face limitations still, but we have a huge range of online support services. Transport to treatment, a transport company through the Cancer Council is available for the northwest clients as well. And again, all the programs that Sandra mentioned before, like the financial assistance, any online yoga, meditation, mindfulness programs are accessible for the northwest clients as well. They've also got the Kids Can, which is directed to the kids affected by cancer as well, so a highly beneficial program too. Nipples on Ripples. So Dragon Abreast Australia is a really good organisation to get involved with as well. This is down in Devonport, which is run on Saturday mornings. An amazing group of people that have been affected by breast cancer as well, and you can join via their Facebook page, or there is an online link on their Facebook page as well, and a really, really good face-to-face group that combines your physical activity as well as that support network, so it's a good one to get involved in. So our rural and outer region areas, obviously with clients that are coming from the East Coast or the West Coast or Northwest, travel, accommodation, financial burdens is a huge factor of treatment and care. So we've got the patient transport assistance scheme, which allows people for over the 50 kilometres to be entitled to some reimbursements, whether or not that's through your travel claim or accommodation claim as well, especially for clients that are perhaps coming from King Island and Flinders Island as well. That's definitely a must go-to connection. So certain accommodations here in Launceston do offer discounted prices for their accommodation. So the Spur Wing and Marillip House, which are quite close to a lot of our treating facilities, Launceston General, so that's a really good place. And if you're not quite sure, or if you know of someone that is coming up for surgery or consultations and things and you need some directions, just talk to either Jill or ourselves and we can point you in the right direction. So ongoing support and survivorship. So this is a big thing, the survivorship that Sandra and myself have been talking a fair bit about lately. It's definitely where we're noticing a bit of a gap. Appointments slow down, treatment eases off, you're not seeing those regular surgeons or oncologists, so you can really come away feeling a bit dumped, I guess, in your care. So this is where I guess having a good GP or a connection with your GP is a really good plan to check in with them about your long-term mental health, your survivorship, your care plan, so they can offer a lot of ongoing support. Support groups, so through the Cancer Council programs, we've got some lovely Facebook pages, the Booby Bunch, which is always a good online or face-to-face options, and I still highly recommend that because you're getting the shared experience that others firsthand know about. So your breast care nurses, like I mentioned before, yes, we are here through that treatment and diagnosis phase, but we are here long term as well. So you are welcome to always throw us a question, check in with us. That's what we're here for. So your follow-up care, you will still engage with your surgeon and your oncologist on a regular basis throughout your 5 years after treatment. And then after that 5 years, that's again encouraging you to check in with your GP regularly. And your physiotherapists and any lymphedema specialists are there for that ongoing support as well. Take home messages. We're here to support you, your family, friends, anyone that's in your circle of group, anyone that has questions. The breast care nurses, we're here to help you navigate the system, communicate through to your physicians, to yourselves, offer you that education and information and go-to resources of where you can, what the local services are or online services. Your BCNA, always a good go-to point as well. And again, your GP and the Cancer Council service. So that's us.
Thank you. Okay.